Mr. Tuma?
Here.
Ms. Baker?
Here.
Ms. Brown?
Here.
Mr. Miller?
Here.
We have a quorum, and I'd like the record to reflect that Mr. Brady is in attendance.
All right. Has anyone signed in for public comment related to the agenda?
No, Madam Chair.
All right. Item number 4, approval of minutes from the May 31st. Can I have a motion to approve the minutes?
Second.
Moved and seconded. All in favor for the May 31st minutes, say aye.
Aye.
We have one item referred to the committee today. Chrissy, if you can please read that into the record.
Resolution 2017-0115 authorizes amendments to contracts with various providers for the Teen Pregnancy Prevention Program for the period 11/1/2015 through 12/31/2016 to extend the time period to 12/31/2017 and for additional funds as printed on the agenda.
Thank you. And may you state your name for the record?
Good afternoon. Robin Martin, Family and Children First Council. Just a little background on this contract. Our office has been working with various school districts on teen pregnancy prevention since probably around 2000. In 2012, we were looking at a comprehensive evaluation of all of the programs that we work with, and we decided that it was time to do something new with our teen pregnancy prevention program. So we pulled together a group of stakeholders across Cuyahoga County and had them really look at who should we serve, and is there a better way or better curriculum to use to do it? Because the curriculum we were using at the time was pretty outdated compared to our kids, with some of what our kids are doing right now. So we went through the federal website and we vetted all of the programs. We looked at setting, we looked at age groups that the curriculums address, and then we actually looked at the curriculums. And we were fortunate enough to find, because a lot of the programs on the federal website were out of date, we were lucky enough to find a brand new one that was hot off the presses, that had just gone through and received sanction to be evidence-based. So we selected a program called Get Real. We worked with the Cuyahoga County Board of Health to look at the teen pregnancy prevention numbers across all of the municipalities in Cuyahoga County, and we were able to group them together as school districts. So at the time, Cleveland Metropolitan School District was receiving a CDC grant from the federal government to provide teen pregnancy prevention or comprehensive sexual education in their school district. And the Board of Health received a federal grant, and they were looking at the next 7 school districts on the list. So we took the following 6. So we went through a process of reaching out to all of the school districts. When we spoke to the pupil personnel staff, everybody was very excited about the new curriculum. A lot of our districts are struggling with providing health to our students, and because the earlier components of the curriculum really address health more so than comprehensive sexual education, they were very excited about it. However, when we went back to the superintendents, a lot of that disappeared. If the districts had other issues, for example, levies on the ballot, they weren't willing to tackle this and have a levy. So in the original contract, you'll see we have 6 school districts listed: Mayfield, South Euclid-Lyndhurst, Bedford, Berea, Parma, and Lakewood. But in the amendment, we're actually going to serve Cleveland because they lost their CDC grant. The funding ran out, it ended. And of the 6 original school districts we were looking at, we've only been able to work past the issues with South Euclid-Lyndhurst. Other districts have said come back to them at another time, and so we will be reaching out to them this year to try to continue our efforts to bring them on board. But right now, we're looking at Cleveland Metropolitan School District and South Euclid-Lyndhurst. Now, the reason the contract is on your agenda today, because it doesn't meet the financial threshold for council, is as we were going through the contracting process, there has been an issue regarding your workers' comp certificate, and I'm going to turn it over to Sarah to kind of explain what that issue is.
Hi, good afternoon. Sarah Kamak from the Law Department.
The issue that we ran into was under section 501.15A of the Cuyahoga County Code. There are a number of required certifications that each contractor needs to make before we're able to enter into a contract with them. One of these requirements is that their experience modification rating that's issued from the Bureau of Workers' Comp is below 1.5. In this case, Planned Parenthood was not able to make that certification because their experience modification rating was over 1.5. My understanding is that this is a rating that's issued by the BWC related to the number and type of claims that they've had. Workers' comp claims over a certain number of years. I think it's a 4-year look back usually. So we asked why their experience modification rating was elevated. We did get an answer, and it looks pretty standard. They just have had some claims. They had a couple of expensive claims, and that sort of thing. So it's nothing had happened that would be a reason that we would think that we wouldn't want to contract with them for a program like this. But because it's a requirement of the code that they make this certification, we had to include a waiver. We determined that the best course of action was to include a waiver of that particular requirement in this case, so that council could waive that requirement to allow us to enter into this contract.
Thank you. Questions? Committee? Councilman Miller?
Madam Chair, Ms. Martin, how long have we been running Get Real in Cuyahoga County now, and has it been long enough that we have any local evaluation data on how effective the program is?
Because of the issues with the school districts, we have not been able to launch the program yet. We've done a lot of work with the districts to get them to understand why they need to do it, and Planned Parenthood and Beachbrook they've helped us with that. Both vendors and our office have been trained on the curriculum, but the official evaluation will not start until August.
And Madam Chair, Ms. Martin, if down the road some of the other 5 school districts that we did not enter into in this legislation said that they're willing to move forward, would there be additional funding available to do so, and where would that come from?
Right now, we are not totally exhausting all of the funding that we have doing Cleveland and South Euclid-Lyndhurst. The 2 districts that want us to come back and try again are Parma and Lakewood, but they needed us to let them get past some issues they were having before we could come back. So we'll have it within the existing contract.
Okay, thank you.
Madam Chairperson.
Councilman Brady?
Could you give me a little bit of an idea of what these issues are that you need to work through, we'll say with Parma and Lakewood, since that's 2 large suburbs we're talking about?
For Parma, it's a funding issue right now in their community. They've been having problems with their levy, and it's impacted some of our other programming in their community. For example, our FAST program, we've had to cut our time back in terms of when we can provide services. And there's some controversy in some communities about the implementation of comprehensive sexual education. In some communities, families feel that they can do it themselves, or they really push school districts to do an abstinence-only curriculum, which we know does not work. So we have to go with whatever the superintendent is willing to step forward and challenge in terms of the board. In Lakewood, we really could not get a clear understanding as to why they were not interested. I know in Bedford, they alluded to the fact that they were concerned about what was happening nationally with Planned Parenthood.
Thank you. So in Lakewood, we're not sure. In Parma, it's probably a matter of finances, but it's also a matter of some opposition, some we'll call cultural opposition.
I will say the number of kids that we're serving in Cleveland, if they so right now in Cleveland, so the way the curriculum is written, it covers 6th, 7th, and 8th grade. If we start in Cleveland with just 6th and 7th grade, when we add 8th and 9th grade, it could cover the number of youth that were in most of those other districts. Because they're an even larger school district than any of the others on the list. And let me say, there are other districts other than the ones listed that have teen pregnancy issues. So there are other districts we could reach out to.
I'm pretty sure anybody that has teenagers has teen pregnancy issues. Okay, thank you.
You're welcome.
All right, Director, nothing was wrong with the Beach Brook rating?
No,
Okay, it was just Planned Parenthood?
right.
Okay, you were about to say something.
Beach Brook no longer does residential, and because they're no longer offering residential services, we didn't have a problem with their rating.
Okay. All right, I'd like to make a motion to, ask for a motion to put the amended language in front of us for the proposed substitute. Is there a second?
Second.
All in favor say aye.
Aye.
Okay, so we're working with, so Sarah, you covered the actual requirement of what 501.15A is?
Yes, 501.15A2 is the section that actually refers to this particular experience modification rating certification.
And so for me to understand, it was actually workers' comp for Planned Parenthood. Some employees at Planned Parenthood had filed a workers' comp claim, had nothing to do with us, but because of the criteria that they need to meet in order to get this funding, we had to look at their rating as well.
Well, this is a requirement for actually all of our contracts, that contractors are able to make this they have to be able to make this certification before we're allowed to enter a contract with them. In some cases, this is actually something that's come up on a few occasions recently. I don't know if it's something about the way that they are calculating it that changed, or if it's just something that people didn't realize until recently and now they've started, because it's a self-reporting thing that they're self-reporting to us what their rating is. So, but in the other instances where it's come up, we've been able to use a pooled rating, because some of these companies or organizations are part of a pool, are part of a risk pool, and they get both an individual rating and a pooled rating. If the pooled rating is below 1.5, then we've been able to use that as so that we didn't have to waive the requirement altogether. And in those cases as well, we've asked, why is the rating higher? And they've explained to us, and it's particularly been a problem with residential treatment providers, just because of the nature of what they do. They have an elevated number of workers' comp claims. So that's the reason that this issue hasn't come before the council before, but it is something that we've been dealing with in other contracts. We've just been able to find other ways to meet that requirement.
So for Planned Parenthood, they didn't meet individually the 1.5 or the pooled rating.
They weren't able to use the pooled rating, or it didn't apply to them in a way that we could accept it. So yeah, that fix didn't work for this particular contract.
And so ratings, to my understanding, generally the ratings are looked at basically under construction contracts.
Yes, so the ratings exist for more than just construction contractors, but I think the reason for it being put into the county code the way that it was, much like the requirement that they pay prevailing wage, was related to, it was written in with a view toward construction contracts, because the county doesn't want to be contracting with a construction company that has a whole lot of workers' comp claims or a lot of safety issues. I don't think that the intended purpose of this section was to, prevent us from contracting with an organization like Planned Parenthood or, any of the residential treatment providers that provide services to DCFS.
Will there be language in the code to address these future occurrences that may happen, because we are setting a precedent, so to speak, by if we pass this contract? for
So,
the rating?
we could, there is a legislative fix. I mean, there is a way to fix it, to fix the code requirement, to limit this requirement to just, public improvement contracts, or, we could look at the different cases where we might be concerned about a high experience modification rating and try to limit it to just those, types of contracts.
Okay, thank you. Any questions on that?
Thank you, Madam Chair. Just along the same lines as a chairwoman, I think that probably would be a good idea to address that, just so moving forward, we don't continue to make exception after exception, therefore violating the intent of the original code. So I think that'd be something that law should probably look into, and we should modify if possible. Thank you.
He's got me covered.
Any other questions for the director? Councilwoman Baker.
Thank you. Putting aside the exemptions, and I agree we shouldn't be continuing to exempt, is there any concern about the workers' comp and why this is even brought before us? Is there any concern about the number of incidents that they're having, and is there any remediation that they have said they are going to go through to try and reduce the amount of workers' comp claims?
We don't have concerns. We did ask them why their rating was elevated. They sent us back essentially three reasons or three factors that have affected this. One is that there is a claim that is in its 5th year. I guess they typically only look back 4 years, but for some reason, the Bureau of Workers' Comp changed the way that they do the rating, and I apologize because I don't really know a lot of the logistics of how they do that, but their explanation was that they have a residual claim that was old. It was from 2010, and for whatever reason, it still is being considered in this rating, which that will be going away. And then they had 2 slip and fall claims, which I guess are particularly difficult and can be kind of expensive. And then that kind of leads to the next reason, which is they had a total loss limit. I guess the Bureau of Workers' Comp sets a total loss limit, like kind of a cap on what their workers' comp claims should be, and they were slightly over that in the period that they were looking at. So probably because of these workers' comp, or because of the slip and fall claims that were more expensive. So it's nothing, out of the ordinary that I think we should be concerned about. It's not really anything that they can fix or prevent. It's kind of just circumstance. They did assure us that they expect their rating to go down considerably during the next period. So when they get to July, these things they're rated in July typically. So when they get to July of 2018, they expect their rating to go well, below the 1.5.
They also provided us with their ratings since 2012. And between 2012 and 2015, their rating was well below a 1.5.
May I just follow?
Yes, ma'am.
My limited experience in workers' comp is that once you fall off, you lose your group rating and you become a higher rate. And it takes a few years to get that lower rate back, but maybe this is different. Maybe they're in a different type of setting, but that's been my experience with workers' comp, is that if they take a percentage of the total employees, and if you meet that, and it sounds like they have a few, they typically don't get their lower rate back until a few years after everything's been exhausted. Now, I guess this is different. Have you looked into that at all, or are we just taking their word for it, or?
I haven't looked into it. I believe that perhaps what you're talking about is their rate of the workers' comp, the payments that they have to make for the workers' comp insurance, which we don't know anything about that, and it's not really our concern. My understanding is this rating, the experience modification rating, that will be going back down. I don't know if that's something that, I don't know how that affects what the rate is that they pay, but in their email they did explained that they expect it to go, that it's gonna go back down, and could be as low as 1.18 by July 1st of 2018.
All right, any other questions? Hearing none, I'd like to ask for a motion to approve R2017-0115 as amended. First.
Second.
All in favor say aye.
Aye.
All right, this will be moved to, I take it it's probably second reading suspension. It will be moved to
Please.
the committee of the whole, second reading suspension. Thank you.
Thank you.
All right. Any miscellaneous business?
Madam Chair.
Yes, Councilman Miller.
I'm pleased to report that the Regional Child Abuse Prevention Council has approved a contract which will provide a child abuse prevention program known as FAST, that's Families and Schools Together, in which they create groups in the schools of parents, children, and educators, and they work around parental skills and resiliency and social interaction and such things. And this program is going to be implemented in the Warrensville, Berea, Maple Heights, and Euclid school districts. So I think this will help families. It connects well with what we do with the little bit older children on the academic program. So closing the achievement gap. So it's a very good program, and I'm happy to see this happen. Thank you.
Councilman Miller, you stated Warrensville, Maple Heights, and Euclid. Is that just like a pilot to start? Do they plan on expanding to other municipalities within the county?
It's Warrensville, Berea School District. The Berea School District actually includes 3 communities. It includes Berea, Middleburg Heights, and Brook Park, and Maple Heights and Euclid. So this funding cycle runs through July 1st of 2018, so it's relatively short. And if the program is successful, it could be expanded in the following funding round.
All right, and that funding is coming from the state?
This comes from the state through the regional councils.
All right, thank you. Thank you for that update. Any other public comment?
Yes, Madam Chair, we have 2 individuals signed in. First, Mr. Will Tarter.
All right.
Yeah, thank you for the letter of support.
Thank you. Good afternoon, Madam Chairwoman, Mr. President, and members of County Council. William Tarter from the Center for Community Solutions. I wanted to personally invite each one of you to attend a City Club event next Wednesday at noon. It is a forum on senior housing. I've been very fortunate to be asked to moderate that discussion. Present will be Rosalind Quarto from ESOP. Also, Dr. Richard Jones from the Department of Senior Adult Services, Mark McDermott from Enterprise, as well as Rob Hilton from McGregor Foundation. We'll be discussing a number of facets associated with housing issues in the community, especially as they relate to seniors, and wanted to personally extend an invitation to all of you. So thank you very much for the opportunity to share that with you.
Mr. Tarter, it being at the City Club, is there a cost?
I will get back to you on the exact specifics of that. Thank you.
Thank you.
You bet.
Next, Ms. Liu.
Good afternoon.
Good
Good
afternoon.
afternoon.
It's a surprise for me to hear that particular forum. If you all remember, about 2 months ago, when Mr. Tarter and his colleagues had a presentation here for state budget, they did emphasize the planning for seniors people, doesn't matter what kind of service for seniors, will be way more important than the past. Because right now we do have population in this county are into this age group way more than before. However, these people are also in the shelter. They will not be able to get any benefit from any programs set for outside people still living in apartment or their homes. Even there are programs to prevent senior citizens losing their homes, but it seems like the effort has not been enough, because currently, even for the both public shelters, you have more senior citizens than before, that's for sure. On the other hand, to give the update to all the members here, the 3 grievances that I have filed through all 3 different meetings here, only the first one I was contacted 6 days after I filed it. That was the only exception from my own experience. All others, just like in the past, not getting any contact to tell me for extra information or in any way. In general, in the past, I had to keep going to a client's right officer to get to know if there's any progress on my grievance. Mostly, it could be even over 6 months or even 8 months to get just a little bit. So I can still tell you the grievance system doesn't matter in which shelters. They really need to be strengthened up through your help in the contract, because it seems like none of the service providers really consider this as a big issue. However, putting just one client's officers for all the 40-something programs you expended so much, one person cannot handle all these grievances. That's why none of these things can be dealt with timely matters. And that's why people don't have a faith when they file grievance. That's why they don't file grievance anymore. However, that doesn't mean no problem in the shelter. And that's the reason why all the problem has been accumulated over decades till now. Please help. Thank you.
All right. Anyone else, Chrissy?
No, Madam Chair.
All right, meeting is adjourned.